Can you guys see my screen as presentation mode? Yes.
Good afternoon, everyone, and welcome to our webinar, LHC Reach Out. My name is Jesus Gomez Manso, and I work for Reach Out as an outreach specialist. I'm stepping in for Josie today because we're having a little bit of technical issues with GoToWebinar. So Reach Out is a nonprofit organization here in the Inland Empire. So I just wanted to say that I would like, or this webinar is going to be in English today, but you can also dial in at the number 978-990-5180 and use access code 3126620 to hear it translated in Spanish. Also, this webinar is a safe space for people to express their opinions and beliefs. Please, this is a space that requires respect and empathy. So today, what this webinar is going to be focusing on is about underage drinking, the risks of underage drinking. So this is a webinar that would be very helpful for parents who want to learn about the risk of underage drinking, how underage drinking is affecting our youth, what we can do to help our youth and understand what this is doing to them. In our webinar, our speakers will answer all your important questions and bring you new updates on the subject matter. If you have any questions, you can go ahead and put them in the chat and we'll read them out to our guest speakers at the end of the webinar. So today, our distinguished panel of speakers are Ashley McGowan, our Outreach and Policy Specialist here at Reach Out, and Michelle Holguin, who is our Policy and Prevention Program Coordinator. Like I said, if you have any questions, you can just go ahead and put them in the chat. But without further ado, Michelle and Ashley, take it away.
Thank you, Jesus, for that great introduction. As Jesus mentioned, we're here to teach you guys about the underage drinking problems, the risks, and what we can do as parents and also as a community to prevent underage drinking, because it has been and it still is a common and really trendy problem among our youth. So that without further ado, we're going to get started here. I will take a minute to give Ashley a couple minutes to get ready to introduce our slides, but as Jesus mentioned, we do work in the EP program and we do work a lot with our communities and teaching them these presentations. So we'll go on to the next slide. So we are the Policy and Prevention Program here in Reach Out. We deal with different communities in the San Bernardino County, the Western region. And we do a lot of strategies to help reduce not only alcohol, underage alcohol drinking issues, but also substance use issues among the youth. We do use different strategies such as research, community organization, policy, development, advocacy, and just, we really try to identify and break down the issues that we see in these communities that we serve. And we do have, through community organization, we do have two coalitions that are Partners for Innovative Communities and the Fontana Community Coalition. We also have AP in the Low Desert and in the Yucca Valley region. So for that area, we do have a coalition, which is the Monroe Basin Coalition. As mentioned, we do use media, policies, ordinances, community organizations, which is our coalition members, and capacity building to create safe and healthy communities. The learning objectives for this presentation today are a few. I'll go down the list. So after this presentation, you will learn the problem of underage drinking. You would learn some policies that help regulate the alcohol sales in our communities. You will learn the underage drinking consequences, how underage drinking can be prevented, and how you can be involved in community work. So Ashley will take on the first half of the presentation, and now we'll commence with the second portion.
Hello, everyone. Thank you so much for having me here. My name is Ashley McGowan, a outreach and policy specialist with the EP team, which is also known as the policy and prevention team. So getting on to the presentation, let's talk about the problem of underage drinking, which some of you may be familiar with if you have youth in your home, maybe teens. This is something that could have crossed your mind. But if it's something that hasn't really crossed your mind or something maybe you haven't thought about in a while, just to kind of refresh for you, as you can see here, almost 2.3 million Americans between the ages of 12 and 17 report drinking alcohol each month, according to the latest national survey on drug use and health published in September of 2017. And in 2018, 7.1 million young people ages 12 to 20 reported that they had drank alcohol beyond just a few sips in the past month. So as you can see, this is still a very prevalent issue within our communities and something that the EP team focuses heavily on so we can try and address this in each of our communities. And I also want to note that these stats may look differently, especially in the past few months during the pandemic, because we know that alcohol has actually become more easily accessible to youth, what with alcohol deliveries and takeout, and people may not be following the procedures when it comes to checking IDs. So these numbers might actually be a little bit higher. So keeping that in mind, addressing the drinking levels among youth, the 2017 Youth Risk Behavior Survey found that among high school students during the past 30 days, 30% drank some amount of alcohol, 14% binge drank, 6% drove after drinking alcohol, and 17% rode with a driver who had been drinking alcohol. So back to the binge drinking statistic. For those of you who don't know, binge drinking qualifies 4 to 5 drinks in 1 hour. So that's 4 drinks for females and 5 drinks for males. And then I also want to point out the last statistic there, the 17% rode with a driver who had been drinking alcohol. So I always say, even if you have a teen or a youth that you're close with and you don't feel like they would engage in underage drinking, this is still just as important to remind them to never get in the car with someone who has been drinking alcohol or using other drugs, because this could be just as dangerous as them getting behind the wheel. And then continuing on to the other side, the other national surveys. In 2018, the National Survey on Drug Use reported that 19% of youth aged 12 to 20 years drink alcohol and 12% reported binge drinking in the past 30 days. In 2019, the Monitoring the Future survey reported that 8% of 8th graders and 30% of 12th graders drank during the past 30 days, and 4% of 8th graders and 14% of 12th graders binge drank during the past 2 weeks. So these are some alarming statistics, and I know it's kind of easy to get lost in the numbers, but I think when we think about, 12-year-olds drinking alcohol and people who our future leaders, it's important that we take something like this very seriously. So now we have a little pop quiz for you all. I hope you brought your thinking caps. So how many youth die from underage drinking each year in the United States? If you would like, you can go ahead and put this in the chat box. I would like a couple of people to please participate. So I'll take a couple seconds here for you all to type in the chat box what you think the answer is. Looks like people are feeling shy. Don't worry, you don't have to talk. You can just type in a letter response to what you think the answer may be.
I have some responses coming in
Oh,
on my end. So we have D, 4,300. Another one said 1,500. Yeah, so those are the top two that are coming in, 4,300, 1,500.
great, great. Thank you all for participating. We go on to the next slide, we'll reveal the answer. So the answer is D, so congrats to all of you who answered that. I don't have any prizes, but you will receive all of my validation and encouragement for getting the right answer. So congrats on that. So diving a little bit more into that, into the deaths that occur from underage drinking, I know it's kind of hard to see in this little pie chart, but I'll kind of break it down for you all. So 32% of those 4,300 deaths occur from traffic deaths. So that, as I'm sure you may assume, is drinking and driving. That's where those come from. And I'm not a mathematician, but I believe that equates to about 1,500 deaths. And then we have 32% comes from homicides, and then 14% comes from suicides, 9% comes from other poisonings, 9% alcohol poisonings. So all the things that you would probably assume could come from underage drinking. Things that obviously can be completely preventable if we get a good handle on this in our communities. Next slide. So why might youth start drinking? What could be some of the triggers or stressors that could lead young people to feel like they have to get away from these problems? As you can see here, we have some things listed, things like stress. When children worry about things like grades, fitting in, physical appearance, they may turn to alcohol to escape these problems. And I think as adults and maybe as parents, it can be easy for us to sweep these things aside and to assume that young people don't really have a lot of problems to worry about. But this is a really tumultuous time period for individuals, and it could be easy for these things to feel like they're larger problems, and that obviously all these things are very relative. So for a young person, this is the biggest problem that they've ever dealt with, and it's understandable as to why they would want to find something to cope with. But I think it's our job to remember that there are better ways to cope with these things, and it's our job to display these things for them. Also, peer pressure. The age range between 11 and 18 is an impressionable period when youth are especially susceptible to outside influences such as peers, family members, and the media. I remember being a teenager, although I do not like to remember being a teenager, and I definitely remember peer pressure being pretty strong. Peer pressure can also be positive in the sense that if you have friends who don't engage in risky behavior like drinking underage and people who prioritize schoolwork, it's more likely that those surrounded by those would, feel that positive peer pressure. But in this instance, this is going to be more of a negative peer pressure. Also transitions, so life events such as transitioning from middle school to high school, breaking up with a significant other, moving, or divorce can cause children to turn to alcohol, as well as environment. So if children grow up in an environment where the parents or peers drink a lot and or view drinking favorably, they may be more likely to drink themselves. And so if you think about environment, this could be one of the largest factors that as adults we could have an impact on if we are creating a safe and supportive environment for the youth in our lives. Some other reasons to challenge authority. Youth often try to assert their independence and establish their identity, and they may try to do this in manners that challenge authority, particularly the close authority figures they have followed most of their lives, such as teachers and parents, especially if they don't have great support networks as well. SAMHSA reported that young people between the age of 12 and 14 who had reported they had used alcohol within the month prior to their survey got it for free from friends or family members or found it in the house. Easy access to alcohol increases its potential for use and abuse. So going over the warning signs a little bit of alcohol use. If you feel like you see these things in your youth, it's probably good to have a conversation with them. As you can see, changes in mood, including anger and irritability, academic and or behavioral problems in school, rebelliousness, changing groups of friends, low energy levels, and then as you can see, the list goes on, slurred speech, smelling alcohol in a young person's breath. And then we'll get into later to how to kind of approach these problems. It's important that you don't come at them with like an accusatory tone. Maybe there's something else going on that they need help with and they're turning to alcohol to help with that problem. So it's important that we have respectful, open dialogues where if there is an issue, they would feel comfortable talking about that with you. So consequences of underage drinking. Youth who drink alcohol are more likely to experience school problems such as higher absence and or poor or failing grades, social problems such as fighting and lack of participation in youth activities, legal problems such as arrest for driving or physically hurting someone while drunk, physical problems such as hangovers or illnesses, higher risk for suicide and homicide, alcohol-related car crashes and other unintentional injuries such as burns, falls, and drownings, memory problems, misuse of other drugs, changes in brain development that may have lifelong effects, and death from alcohol poisoning. And we're going to go into a little bit more into exactly why these occur and why they manifest. But first, we have another pop quiz for you all. So what part of the brain does alcohol affect? Prefrontal cortex, the cerebellum, the hippocampus, or all of the above? So I'll give you all a few moments to answer this question, and then I'll have Jesus read out some of the responses.
Another thing that's coming in is people are seeing the presentation in presenter view, so we're able to see the next slide.
Oh, very interesting. So you all can see the answer.
Yeah.
Well, you know, that's my bad.
Let me see. I didn't know that you guys were able to see the presenter, not the presenter view. Let me fix that really quickly.
As you can see here, we're not very tech savvy, but you know what? Who is? Not me. I'm just going to pretend that you all would have just gotten the right answer anyway, because I feel like that was sort of an easy question.
So Jesus, if you can let me know if it's on presenter mode now.
No, it's good. We could just see the presentation now.
So it's on presenter mode now? Okay, cool. Sorry about that. But well, now you guys know the answer, right?
Yeah. Yes, so all of the above, correct. Again, I'm just going to assume that all of you were going to get the correct answer anyway.
Okay.
Okay, so diving into that a little bit more, the effects of alcohol on the developing teen brain. Using alcohol at a young age can result in memory loss, impaired decision making, impaired judgment, and impaired communication skills, and they could develop learning problems. And as you can see in this image, exactly where those parts in the brain that would be affected could result in that issue. I'm definitely not a scientist, but I do know a little bit now about brain development, thanks to obviously working in substance use prevention. And so I'll go into that a little bit and kind of scratch the surface of how alcohol can affect the developing brain and which parts of the brain it can affect. So one of the biggest things is memory. So as you can see here, these are the parts of the brain that are affected by alcohol. So on the right, you have a regular teenager who does not drink, and then you have a teenager who is a heavy drinker. So as you can see, all of these pinks and these reds, these parts are not supposed to be lit up like that. So as you can see, these images show that a heavy drinker doesn't activate the same brain areas as a non-drinker normally does as far as memory and learning go. Next slide. And then here, I think this is a really informative image. I know it's a little bit fuzzy, but I'll kind of explain what it's showing. So right here, we kind of have a scale of brain development between the ages of 5 and 20. And all of these colors, all of the reds, the yellows that you see under the 5-year-old brain are parts that are severely underdeveloped and still obviously need a lot of time in order for these areas to reach their full potential. And then once you move on to 20, you see that there is more areas that begin to develop and start to turn the more purple bluish color, which would indicate a more fully developed brain. But as you can see at 20, we still do have patches of light blue and green, which indicate that this brain is still developing. And so since the brain is going through a rapid amount of development between the ages of 5 and 20, it's important to take extra precautions to make sure that our brains are able to reach their full potential as far as capacity goes, as far as learning, memory, judgment making, decision making. We can only ensure that by making sure that youth stay away from things like drugs and alcohol, because the youth brain is vulnerable for developmental problems. I believe it's at age 25 is when the brain reaches its peak development, which is pretty exciting news personally for me, because I have 3 months left until I turn 25, which means that I have 3 months of development to go. So if I make any mistakes now, it's because my brain is not fully developed. So I'll just blame it on that. Next slide.
All right, thank you, Ashley. That was great information, but we still have some more to go. So I'm going to do the rest of the presentation, and I'd like to get started with treatment and prevention options, or just suggestions that are suggested by experts and by different organizations that actually do a lot of research into alcohol use and other substances of use among the youth population. So obviously treatment of alcohol abuse is an issue in younger individuals, and there are programs that can assist them with that. There are recovery centers in San Bernardino County, and I'm sure Riverside County as well, where they have programs for youth that really help them get through the issues they may be encountering, whether that's alcohol abuse or other drug of choice. And also, there's also, as I mentioned, there's such suggestions that they're out there that you can research, that you can learn more about. For example, there is macro level interventions. This is more in regards to policies being established in counties and cities at a bigger level that will reach a bigger audience. And it really can help regulate the alcohol sale, make it harder for young adults or youth to buy or to get a hold of alcohol as easy as it could get. There's also other interventions, school-based. There's programs that, even in San Bernardino County, there's programs that go into schools to teach youth about the dangers of alcohol abuse, the dangers of other drugs. So there's school-based interventions that really inform and enforce the importance of knowing the harms that alcohol could do to their body and to their brain, as Ashley mentioned, since it's still developing. Another intervention that could be applied to prevent underage drinking is family-based interventions. This is more of a family level intervention that you could apply to your household, which would mean practicing and enforcing clear rules regarding alcohol use in your home, and really making or having your youth understand the harms and the consequences that could result if they do engage in risky behaviors such as consuming alcohol. So there are many things that we could do as individuals and as a community. So drinking by those that are under age of 21, which is the legal age, is a public health issue. Excessive drinking contributes to more than over 3,000 deaths among people below the age of 21 per year. And about 189,000 emergency visits have been made by people under the age back in 2010. So we can only imagine with alcohol sales increasing, especially with COVID, we can only imagine how much of a norm and how much people are actually consuming now. Not only youth, but just adults as well, which could captivate and influence among the youth of wanting to drink. And more than 90% of alcohol consumed by those under the age of 21 are consumed by binge drinkers, or they binge drink, which is 5 or more drinks per occasion for boys and 4 or more drinks per occasion for girls. So it's mentioned there's ways to regulate the sales of alcohol, but there's also state laws that really require states to be more careful on how they distribute the alcohol and how alcohol could be illegally purchased. So for selling or providing, these are for on-sale or off-sale establishments, which is restaurants or liquor stores. They have to make sure they're not selling to minors. So there's this thing called no cash changes hands or no money changes hands, which is pretty much um, not giving someone a product just because they're trying to obviously get it from you and they're trying to make a sneaky transaction in order to get it from you. So obviously that wouldn't be allowed. So there's strict regulations on laws that regulate that and prohibit from that from happening. Also minors, obviously it's against the law to sell alcohol to minors, and many state laws do this underage persons or minors through the terms are synonymous. So they try to I know there's a lot of police departments and other departments, the ABC, they try to see if minors are getting sold alcohol, and if they are by liquor stores or establishments, they could deal with big penalties. Mistake of age, as many of us are aware, minus, they do try to start drinking at a young age, and by that they do things that are kind of, they're pretty desperate to kind of the trend of drinking alcohol. So they try to obtain a fake ID, they try to lie about the age. Some youth do that, take the extra step to get try to buy alcohol. So it's really important for the state and its approach to really know how to define and deal with that situation. So obviously there's different methods and extra steps for them to make sure that the youth or the person is in line about their age and the ID is credible. And then lastly, parents, some of us, some adults in general, they enjoy drinking and maybe they're around a minor, but it's really important to know that it's they could deal with a penalty if they're providing alcohol to youth, and I'll talk about it later today in the presentation. But there are penalties if the adults are purchasing alcohol for young individuals at their home or even at establishments, which also has to do with the training that the establishments have received. So I had mentioned that there's a macro level, and then there's such as like state laws, but also if we kind of narrow it down, there could also be local policies and ordinances that really regulate the sale of alcohol. There are actually 5 stages for how a county could adopt or could regulate the alcohol sales. So these are some of the policies that they can adopt if they see that that's an issue in their community. So for example, the first one, it's called Responsible Beverage Service Ordinance. And this one really, there's a law that, this one is really makes establishments that sell alcohol, so on sale, which means restaurants that are selling alcohol, really understand the procedure and really get trained enough for them to know who to sell alcohol, how to ask for IDs properly, not to sell to individuals that are intoxicated. So they do go through a training and they get certified. And these individuals they could be people that are selling alcohol. So it doesn't even have to be just the server. It could be managers because they're supervising and maybe have to step in at one point to serve alcohol, or just other employees. So and there's actually new law incoming for next year that they have to be trained when they get the job. If not, I believe they would have 60 days to get trained. So it's really important for on-sale establishments to get trained and know how to handle alcohol sales. Another one that is one of the policies that could be implemented in communities is the conditional use permit ordinance. So this requires the licensed establishments to be a minimum distance from schools. So they could have it can't be 2 miles from a school. The city can establish that regulation. It could also limit the alcohol sales to certain hours, maintain nighttime lighting, take action all public safety issues that they could take into consideration to really prevent unhealthy or illegal alcohol sales. The third one is public convenience and necessity ordinance. This helps to stop the overconcentration of small convenience stores that lower the quality of the neighborhood. So for example, if a city has way too many alcohol, it could be liquor stores as well, or restaurants that sell alcohol in one area, so in like a specific radius, and there's just too many, they can this ordinance does not allow that to happen. So the licensed establishments, they actually have a limit to every city through the ABC regulation agency. So if they have way too many, that means they're over concentrated, and the policy will help regulate that. So that won't happen. The fourth one is deemed approved ordinance. This is another zoning purpose ordinance to apply the CUP, so the conditional use permit, to equivalent standards. And the last one is the social host ordinance. This one's more for if it's implemented in a city. Let's say an adult decides to have a party, or an adult just decides to buy alcohol for their minors at home and invite their friends. If a city does have this ordinance and they know, or they, there's some sort of suspicious activities going on too, so police, there's some sort of attention captivating to that home, and they do an assessment, or however they realize that there's minors drinking at their home and it was because the adult provided it, they could either, depending on the situation, they could either face a court, a penalty. So it really depends on the severity of the situation, but there's different routes that they could be accountable for. So these are some cities that already have passed the ordinances. So as you can see, there's a pretty long list, especially for the social host ordinance. But some of these cities are in other counties, but it's good to know, because it's good to be aware that the city, what ordinances our cities have, and if they don't have it, maybe it's a good idea to encourage community members and inform them about the issues and what possibilities there are to implementing a policy that could help regulate and also decrease the issue when it comes to underage drinking in their city. So out of these, you could see that the conditional use permit, or local neighboring cities or local cities here in the Inland Empire have them, such as Fontana, Ontario, Rancho, Chino. Another city, or another ordinance that cities have around here, San Bernardino has the deemed approved ordinance, Ontario public convenience necessity, and for social host, it's Ontario, Fontana, San Bernardino, Corona. So there's some cities here in the Inland Empire that already have it, but there's so much work to be done, and there's enough information and enough worry or enough concern that underage drinking is still an issue. So it's a good opportunity for us to be aware, so we can, as us as Reach Out and other coalitions around the county, could really focus on pursuing necessary policies that will help lower the issue of underage drinking. So it's mentioned that adults have a huge influence on the youth when it comes to deciding whether they want to drink, or it may be other substances, but there has been studies made that really do provide evidence that students have answered with the fact that if they're allowed to drink at home, or if they see individuals that they live with drinking at home, it's more acceptable for them to drink. So it's more easier for them to say yes when they're offered an alcoholic beverage and maybe their parents aren't around. But since they see it at home, they're more influenced to say, okay, it's okay to grab a drink, even though I'm under the age of 21. So that just influences them, and it's a huge thing to know and to be aware of, because as adults who are part of a child's life, we are the influence, and we are the, whatever we do, they follow, or they see, they observe. They're good observers. So it's really important to keep that in mind when deciding to get involved in drinking or drinking around the house. Just important to keep in mind that youth do pay attention to our actions. There's a lot of adult misperception about underage drinking. So there's a lot of things that adults may say that they don't it's the youth gets a different translation or perception of what they had said. So for example, maybe you've heard adults say it's okay if they drink under my house or supervision. I drank at that age, like nothing happened, I was fine. It was like an experiment and I enjoyed it. It's okay for special occasions, so maybe on the weekends for a party, something to a reason to celebrate. Like they'll say these type of things, but at the same time, it doesn't necessarily um, translate to something that's like they without wanting to, they influence that on the youth, and the youth will take it differently. They will think that it's okay if I start drinking. Oh, there's a party. It's okay if I drink because that's what my parent or my guardian said. So youth will take that literally and will do it because they feel like it's a norm or something normal for them. And also youth could also start drinking at the home because a lot of adults say, oh, it's okay if they start drinking. I'd rather have them do it at the house, right? So then if they know that, they feel more comfortable drinking outside the house and they're more likely to do so. And there's just more information, a lot of research that's been done on the developing brain, as Ashley mentioned earlier, and how it could really impair and really distract it from developing it at its fullest potential. So it's a lot of things we need to consider as adults and parents. So there's a video here. Unfortunately, I wasn't able to connect it to the audio, but I know I was able to put the subtitles on here. So I'll play it for about halfway, and you guys could follow along with the subtitles that you guys see at the bottom. And then I'll just kind of summarize it after we all watch it. Okay, so you guys get the idea. This was a video. Obviously, it's very sarcastic. They made it seem like, oh, it's just like, we're just messing around, but want to have fun, especially during quarantine. So this was made during the stay-at-home order. Earlier this year, I believe it was towards the beginning of the stay-at-home order. It was made by Saturday Night Live. I never watched Saturday Night Live, but I still somehow found this video pop up and I still watched it because it was trendy, right? It had over 1 million views on YouTube. That just comes to show that, so many adults, even youth were watching this video, even though Saturday Night Live, I'm sure they're not telling babies to drink or telling their parents to teach their kids to drink as a kid or a baby with only a few months old. But um, you never know how the individuals are receiving this message, especially if it's something that really is streamlined to over 1 million views. Even adults or youth could see this as, oh, like, even they're telling us to drink, so maybe we should do it, or maybe it'll be good for us because we're in quarantine, we have nothing else to do, let's try it. So it really did give it was a lot of there was a lot of controversial conversations around this in the public health and like other webinars I attended. They discussed this video and it was very controversial. Obviously, I'm sure it wasn't their intention, but it was still out there, and it was still for millions and millions of people to see this video. So that was really interesting that they came up with this, and um, well, knowing that underage drinking is a huge problem, and it has been. So that's just a little video that I'd like to show to really show that there is a lot of misperceptions when it comes to underage drinking. I had mentioned earlier that there are a lot of preventative ways and strategies to help reduce or prevent underage drinking, and I had mentioned that family family regulations and family, um, rules really can apply to preventing underage drinking. So that really stems from the fact that adults or guardians should really have an important conversation with their youth. And even though it's really hard to start because you don't want to get ideas in their head or you maybe don't want to say something that you don't feel comfortable saying and they might take it the wrong way. But it's really, really, really important to have these conversations with your youth, no matter if you think it's really uncomfortable or awkward or weird. If it's not going to be uncomfortable if you don't make it. So it's really important for us to, as adults, to have significant influence on the youth or your children. It's better to talk to them before they're exposed to alcohol or drugs. Always having that conversation, letting them know that you care, you're aware of the consequences and the harm. So it's also important to educate yourself on that. The older they get, the more likely they're going to want to try it. Other factors could be their peers doing it or peer pressure at school. You never know what's going on in school, so it's important for you to be aware of what's going on in school, and you could start that by having a conversation with them about it. Again, not talking to them may send the message that, you're okay with them drinking because you're not talking about it. So they may think that, even though that's not it. You may just not be ready to talk about it, but they're not thinking that. They may think, oh, it's okay because it was never addressed at my home. And some children may try alcohol or drugs at a very young age. You saw the statistics in the beginning of the presentation where it was as little as 12-year-old kids consuming alcohol. And not only that, there's also plenty of research that shows that kids in middle school, even in elementary school, are exposed to drugs. So they know what drugs are, and they've possibly tried them because the people they're around are into that. So you never know. That's why it's so important to have a conversation with them. You don't have to have a long one. I would encourage, adults or parents to have small conversations because they go a long way. So every day, try to use an opportunity to talk to them, whether that's during the car rides, at home. Not that we're distance learning. There's a lot of opportunity there to talk to them after school or whenever you feel is most appropriate. Having lots of little talks kind of reminds them, refreshes the memory that you don't think it's okay for, you don't accept alcohol in your home, or you wouldn't accept it from them. So it's important to have that clear message. So get into the habit, and when do make your views clear, as I mentioned. And as they get older, the conversation will change. So kind of, it's important for you to be aware of that as well. You wouldn't talk to a youth or a 12-year-old the same as a 18-year-old or 17-year-old. So it's really important for adults to be aware that as they grow, the conversation could change. It goes both ways. When talking to a youth, you can tell them your rules and your what you're aware of when it comes to alcohol, but it's also important for them to have some time to talk to you too. So make it go with it's important to talk to them both ways. So it's not just a lecture, and if you do want to talk to them about this, you're able to also hear their input and what they think about it. So, and also, as I mentioned, adults are a huge influence, and it's important to do what you say. So if you choose to drink, or if adults choose to drink, it's important for them to do it in a moderation and never influence them or show them that it's okay to drink, drive while drinking. Because of course that would also kind of give them the idea that it's okay to do that. And we all know drinking and driving do not mix well. So it's important to also illustrate that to our youth. And also something that you can that parents, adults, or guardians can also include in the conversation is really trying to identify what the youth enjoys doing. So that way you can kind of give them the idea of them having the extra time being at home, and really give them the idea to help them kind of focus on engaging in coping mechanisms and keep themselves busy. One coping mechanism may not fit another person. So again, it's important to identify what they really enjoy doing so they will focus and actually stay committed to their coping mechanisms or whatever they enjoy doing, and that will keep them busy. And it could be a help and possibility for them to not engage in other risky activities. So this was a campaign that we had done as a program for our community. It's from SAMHSA. We encouraged parents or adults to use an app. So SAMHSA, if you go to samhsa.gov, they do have a lot of resources, and they have an app for your phone on either whether you have an Apple or Android. You can download Talk They Hear You app, and really helps you navigate through the conversation when you want to talk to your youth on underage drinking. So it gives you two avatars, and it gives you idea or prompts on how to start the conversation and how to keep going. So if you're stuck, there's options for you to choose from, and you could choose any, and then the conversation will go based on what you had chosen. So it gives you ideas on how to ask questions, and the child's avatar responds to your questions. So it kind of gives you like a real life scenario of what can be done when talking to them about this. You learn the do's and don'ts, and it's really captivating, and it really does help you navigate through it. We did survey a couple parents that had said that it was very useful, and they would recommend it to other parents if they would like to engage in this conversation with their youth soon, and use a helpful tool that would allow them to do that. You can find more resources on underage drinking to help understand the issue and getting any updates on the issue. So SAMHSA is one of the resources we used for this presentation. The Centers for Disease Control also has a lot of information about alcohol, NIH, NIAA.nih.gov, HSS. And then also, if you just Google underage drinking, it'll give you a lot of other websites you can visit. And there's a lot of flyers, there's tools you can use if you provide services to the community and it's related to this substance. There's a lot of more information to use, the toolbox and other things that you can find that are pretty cool. That's what we use a lot of when it comes to some of our campaigns. So that's the end of our presentation for underage drinking. I hope you guys learned a thing or two, and I hope you guys found it useful and informational. But I would like to end this presentation with a couple more slides and announcements. One of them being, as I mentioned in the beginning of the presentation, we do a lot of community organizations. So if you would like to take part in making a difference in your community, our program offers a lot of that opportunity for community members or partners. We have two coalition meetings. I help coordinate the Fontana Community Coalition, and Ashley helps coordinate the Partners for Native Communities. We meet on a bi-monthly basis. So whenever Fontana doesn't meet, it's picks month. So it goes switches on back and forth on the missed meetings of them throughout the year. So I just had Fontana. It happened last week, but there's an upcoming one for Partners Innovative Communities. And really the purpose of these two coalitions is to work with the community members, with partners, stakeholders that are already part of coalition. And obviously we'd invite more people. We always continue to try to recruit new members, but we get together and we really strive to developing, media campaigns, policy development, conducting research, really discussing and really identifying what issues do we see in our communities and what could be done about it. The purpose of coalitions is really to get that group that's passionate about the work, that's willing to commit on the work, and this is really to make a difference. And obviously, we also try to build the capacity of our members, teach them the issues, teaching them the tools so they could be successful and efficient when it comes to making a difference in their own community. For both, we do focus on substance abuse prevention, and additionally for Partners for Innovative Communities, there's two other priority areas that we focus on. We focus on restorative justice, so finding alternatives for the juvenile system, and then we also focus on school climate when it comes to mental health and substance use. So there's three priority areas for that one, and our next meeting will be on October 22nd from 12 to 1:30 on Zoom. And if you would like to sign up for any of these coalitions, right now they're being held on Zoom. Please email me or Ashley, and we're more than happy to add you to our list. In person, we would meet in Fontana for FCC, and then in person for PIC, we would meet in Ontario Police Department. So we have a great spacious space for us to meet whenever we're able to get together in person. Please feel free to reach out. They're great coalitions. We always look for new members, and we're excited to have you all join. Another announcement I would like to make is that as policy and prevention program, we're funded by the San Bernardino County of Behavioral Health, and we are asked, and we want to identify the issues that are within our communities, right, when it comes to substance abuse prevention. We do have 2 tools that allow us to do that. We have 2 surveys that we disseminate throughout our communities for community members to really tell us what their perception is on alcohol use or drug use among their community members, and it allows us for the county to know what the problem is, and they could allocate funds to really provide programs out there that will prevent those issues among our communities. So if you do live in the cities of Fontana, Upland, Montclair, Rancho, Chino Hills, Yucca Valley, Joshua Tree, 29 Palms, or Landers, it would be of huge help if you were to participate in our surveys. And I will take a minute here to put the links on there. Um, I can't, okay, here's the chat. I will link it there. So whenever you guys have an opportunity to do that, I will share, the links on there for you guys to take those surveys. My last slide is our contact information. As mentioned, I'm Michelle Holguin, and I'm the coordinator for the program, and Ashley's the outreach and policy specialist. There are emails if you would like to reach out to us for other presentations, if you'd like to be part of our collaboratives and be on the list, please use those emails to communicate with us. And then we also have our social media platforms, which is Facebook, we are Reach Out, Instagram, Twitter, and YouTube. And that is the end of our presentation. I hope you guys enjoyed it. I will link the links on the chat for those of you that are interested in taking our surveys.
Let's give a virtual round of applause for Ashley and Michelle. I know we're running a bit late on time, so I just wanted to give the floor to Josie, who was able to join us about halfway through the webinar, and she wants to talk a little bit about our exciting CCPL program.
Good afternoon, everybody, and I apologize. The computer froze me down, so I wasn't able to get on. I'm just promoting and letting you guys, reminding you guys about our new program that's Healing Community Through Racial Justice. The Centers for Civic Policy and Leadership is putting it on. We are accepting applications if you guys are interested. This is a very good program. The purpose of this initiative is to increase the Inland Empire capacity of engaging in and promoting the racial justice movement. This cohort is going to be a very great program that we're having. We just wanted to remind you guys we're accepting applications. You need to apply, and it's a commitment for 15 months. And we're going to learn a lot, do a lot of different things. We are giving $10,000 to all the agencies, and we're opening it to everybody: agencies, educational, government, cities, counties, schools, program colleges, businesses, human resources, law enforcement, faith-based organizations, anybody that wants to learn a little bit more to see how you can implement all this into your organization or your agency business. It's very get to know each other as persons, and then I'll go on to how to implement it into your organizations or your businesses. It's a very good program. I'm gonna put just the website, and so you guys can send the application. I know that we had opened it and accepting applications till October 22nd, but we are going to commit it and move it forward till the 29th of October. It is a very easy applications. We can bring up to from 1 to 3 persons of each agency or business to learn. We are going to have money for 10 agencies. We're looking for more money to pay more agencies or businesses, whoever wants to apply. And this is going to be based on whatever you want to use the money, either for, it's a commitment for 4 hours once a month. So for the persons that attend, you guys can replace the money for their salaries or whatever you guys want to use the money for your agency or business. I just want to thank everybody, and I thank Michelle and Ashley for the great presentation they gave me, or they gave us, I'm sorry. And I just wanted you guys to look into this program, and it's a very good program to continue. Thank you very much. And I would like to say have a great evening, and I will talk to you guys next week. Thank you very much, everybody. Make sure you guys look into the program and go ahead and apply and see what you guys like about it. It's a very, very good program that we're going to put up through Center for Civic Policy and Leadership. It's a very, very good program. Look into it. I recommend it. And thank you very much. And we'll see you next week. Thank you. Have a good evening.